Hello everyone, welcome to today's talk. The topic today is the intensity of ABA intervention for individuals with ASD. It is called a key to maximizing outcomes for children with ASD, the intensity of interventions. And I have several things I want you to learn about during this talk. You see listed here. One is sort of the basics or foundations from which this talk rests upon, which is that early intensive intervention is effective in treating the symptoms of ASD. This has been shown several times in many different studies, tracing back to the very beginning, all the way back in the 1960s, but has been replicated over and over in different institutions and settings, with different individuals, of course, and the replications are continuing to occur. Some important ones that were done somewhat recently, relatively speaking, were done in 2013 and 2016. Another point that I want you guys to learn about today is that low intensity treatment is ineffective. Now, what do I mean by that? What I mean by that is low intensity treatment will not only not give you as positive an outcome as high intensity treatment, but low intensity treatment very often gives you no improvements whatsoever. I'll talk more about that. Another key point I want you guys to learn about today is that intensive behavioral treatment is more effective than eclectic or varied treatment. This has been shown in different ways over the years, but several important studies have demonstrated that adding in non-ABA treatments into the collection of services that a child is receiving tends to interfere with improvements overall. Another key point to learn is the intensity of treatment is important across all ages. People often think ABA is just for little kids, and of course it is very important that intervention starts as early as possible. But that doesn't mean that once a child gets out of their early childhood years, ABA cannot be helpful. It still can be. And then another important bit to learn is that intensity is essential across all treatment domains. Treatment domain is kind of like an area that is targeted for improvement, an area that is seen as having some measure of deficit or impairment. And I'll talk more about that. All right, what I want to begin with for this talk is a graph. It's actually two graphs. You see one now, the other one will be coming in a minute. And the graphs are not of a specific individual, but they represent a kind of general path that two types of individuals could be on. This first graph shows how somebody with ASD who's not receiving quality intervention may develop in terms of their what's called developmental age. Developmental age is, depending on the skills being assessed, is the kind of age equivalent where somebody stands on those variables. You are probably familiar with certain targets that are seen as developmental milestones for children, say being able to walk and talk, and certain growth targets. This is more about, how their learning is going. And of course, for a typical child, on average, when they're 1 year old, their developmental age is like a 1-year-old. For a 2-year-old, their developmental age is usually like a 2-year-old's, so on and so forth. But students with ASD lag behind, and this graph, the green line, is sort of typical development, and the blue line is individuals with ASD who are not receiving quality intervention. And there are several key points I want you to take away from this graph, but two that I'll mention right away. One is that you'll see that the ASD individuals, they do learn, they still develop, but it's much more slowly than typical children. And importantly, you will also see that the gap between the individuals with ASD and the typically developing people is getting wider as they grow, as they age. And that is a very common pattern. I want to point out that I'm talking about quality intervention here, or the lack of it in this graph. Quality intervention, as I will talk about today, part of that is the intensity of it. You could have the best therapists and supervisors in the world working with your child, but if they're with your child for an insufficient amount of time, you won't see much progress. And so, the intensity is very important, but intensity also is not everything. If you have your child working with a therapist who doesn't really know how to effectively implement programs, if you have a supervisor who doesn't have much experience or knowledge to make judgments that are really individualized for your child, in spite of the time that you're putting in, the improvements are unlikely to be there. And that is why, I could do a whole nother talk on this, but we spend a lot of time training our staff. We're very selective about who we hire, and all of that is in the direction of making sure that the families who are with us receive high quality intervention. All right, and so that's this graph. Let's look at the next graph. So this is what a pattern can look like for an individual who has ASD, who's receiving high quality intervention. You see the blue line is dramatically different, right? The students sort of are starting from a similar place, but then with the intervention, they learn much more quickly. So it's not just that they're learning more quickly, though. It's also that they catch up to the green line, typically developing individuals. I want to make a few points about why catching up is so important. So first of all, a lot of times the students that we work with are quite bright, actually. They don't have any kind of cognitive impairments. Some do, but many don't. And in fact, if you were to look at the diagnostic criteria for ASD, intellectual impairment is not part of that. Again, some individuals with ASD can be cognitively impaired, but many, if not most, it is most. Most are not cognitively impaired, especially initially. And so what they really are lacking are a lot of prerequisite skills to be successful in places, let's say, like school. they don't know really how to be a good student, and they don't know how to socialize effectively with their peers, and without intervention, they don't really learn those skills well. But what's happening here with this graph is that somebody who is receiving high quality intervention will, in fact, start to learn many skills that their typically developing children have learned. And in fact, they can learn more quickly once they start receiving high quality intervention. In fact, they have to in order to catch up. And the catching up is really the essential part of this graph. The gap between individuals with ASD and typically developing children is, in a way, the key difference here, and we're trying to close. We're going to try to close that gap all the way. The reason why closing the gap all the way is important is this. If you're able to close the gap all the way, what that means is this child should not need any kind of intensive services anymore, because they're able to learn effectively in the natural teaching setting. They don't need somebody with them at school to be able to learn the way the teacher is teaching everybody, right? They're able to interact well with their peers and make friends because they know how to do that now. They don't need somebody there to help them anymore. But that will only happen if the gap is really closed all the way. Problem can be this, and this is a common, all too common scenario that I see, where students close the gap somewhat, maybe get very close to where they need to be, but not all the way there. But parents and other caregivers are very happy with the progress that they made and are maybe less motivated to put in all the time and effort, and it is a lot of time and effort to receive the ABA, and they maybe end a little bit sooner than they should. But then the problem is, what happens is that the gap starts to widen again between their children and the typically developing children, because there are certain things that they're missing along the way they're being taught, the typical way they're being taught. And so that gap ends up becoming a problem again. And it can be more difficult to close as the individuals get older, which probably doesn't surprise you to learn. So understanding that, the importance of closing that gap, and how starting at a young age is so essential, is what I need you to know as part of this presentation. Starting early, I'll talk more about this in a bit, but that will make a big difference compared to when you start, if you start later. All right, and let me talk about the second point that I mentioned, which is that low intensity treatment is ineffective. So again, I'll repeat what I said before. The low intensity treatment is not just going to lead to improvements that are maybe not as robust as improvements that would be seen with more hours. It's that you may not see any improvements at all. It's not a situation where, hey, if I do 30 hours a week, I'll be able to reach this high, but if I do 15 hours a week, I'll be able to reach half as high. It's not like that. It is often where if you're not doing enough hours, you are not seeing any improvement at all. It can be a little bit complicated why that is, but I've been trying to think of some metaphors that would explain it a bit. You see the picture of the car there that doesn't have all of its wheels, and to a certain extent that's like what receiving ABA but not enough hours is like. You won't get very far without the full treatment. I know it can be hard to believe that having treatment this intense is really required. But it's an unfortunate reality of the situation here, which is that, if you think about it, like we're trying to change somebody's brain by how we talk to them, how we react to what they do, how we position materials out on a table. If you're really thinking about what we're trying to accomplish in that way, on one hand, it can be kind of surprising we're able to make the changes that we can make at all. And if we don't have the full power to operate and do what we need, we just don't see the improvements that we are looking for. And this has been demonstrated in research. There was an article that was published, a study, back in 2010 by somebody who's named Peter Fischer et al., meaning some other authors too, who demonstrated that ineffective treatment for ASD and the emotional and behavioral symptoms that go along with it is what you get when treatment is not intensive enough. Without the hours, we just don't see the results that we need to see. Another critical point to keep in mind that I mentioned earlier is that eclectic treatment is ineffective compared to intensive behavioral treatment. This can be another idea that to some degree can be difficult to believe because it may seem counterintuitive to people. I understand, people are going to know that certain treatments just might not work. But what's going on is actually more complicated than that, which is that you can have a treatment that works, but if you add other treatments into that, it can make the improvements that we would see with the effective treatment disappear. This was another one I was trying to think of a metaphor for, and you see the dish of food there, and I know for me, all of those ingredients individually, I like actually. But if somebody made me eat that, I don't know if I could even do it, because even if you don't like these ingredients individually, you can probably imagine that if you were to eat these all together, it would taste really bad. And that's how, or it's how to think about how eclectic treatment can really diminish the effectiveness of ABA that's being done. There's, of course, another side to this, which is perhaps a little bit easier to understand, which is that if you could be doing an effective treatment for, let's say, 30 hours a week, but instead of doing that, you do 15 hours a week plus 2 hours of OT and 2 hours of speech and 2 hours of physical therapy and 2 hours of this and 2 hours of that, to where it all adds up to 30 hours. That's not going to be as effective as doing the treatment that really is effective for more time. I think that makes sense to most people. But again, it's more than just that. It's adding in other treatments kind of pollutes the treatment environment. Let me explain a couple of ways in which that pollution actually plays out. So one is that the consistency with which people are working with a child will be diminished. You may know, and if you don't, it probably won't come as a big surprise to you, that consistency can be very important in working with our children. That we are trying very hard for them to learn certain contingencies, how to use language a certain way, how to respond to grown-ups and possibly peers, depending on how early on you're doing the treatment. And if the consistency in teaching those things breaks down, then the learning will break down as well. The student can become confused and not know how to respond properly, and the learning becomes very inefficient with that kind of teaching. And it's not just that the strategies may have some inconsistencies, they may actually conflict, conceivably. Certain providers may be paying a lot of attention to certain behaviors. Other providers may be ignoring those same behaviors. And then you'd get a kind of response from the child that you wouldn't be looking for. Another feature of behavior treatment that makes it so effective is how systematic it can be. We can break down what we're trying to teach in very fine parts and move along step by step as the child learns. And we're very careful about that. The problem is, if you have other individuals doing different types of teaching, it interferes with the systematic nature of treatment. There's one other kind of indirect aspect to the eclectic treatment model, which is a kind of red flag, which is that oftentimes, and to be honest with you, it's almost every time, that people are doing eclectic treatment. They're doing treatments that are just ineffective, not going to work, are being pushed by people who either do not know what they're talking about at all, or are essentially some kind of like scammer or grifter. In my decades in this field, I've seen all kinds of fad treatments come and go, quick fixes, easy ways to solve problems, miracle cures and all this. None of them work, and they all, by definition, as fads, they fade away once the more general, let's say, ASD caregiver public becomes aware that these treatments just are not working. They oftentimes involve sort of things related to diets and eating, but they can also be some other kind of like medical treatment that has no real scientific basis behind it. All of these things are interventions that I would really caution against. What I will acknowledge is that the reason that those kind of treatments are so common in our ASD treatment world is that the treatments that are effective are not easy. It's not easy for a family to spend 30, maybe even more hours a week doing ABA, for instance. A lot of time, a lot of money, a lot of stress. And under those conditions, people can come in and sell the quick fix. And desperate families will go for that, which I understand to a large degree, how that kind of need for some other solution is so appealing, right? And I've had parents that I've worked with explain their thought process for how they came to try some of these things. And their thought process is not necessarily flawed, but it's ultimately too ready to believe what they want to believe. And they end up going astray and wasting time and wasting money in the process. And so I really caution you against poorly researched and treatments that have no scientific support behind them. All right, the next bit is about age. So This, of the different points I want you to learn about, this one is a bit subtle. What I mean by that is, the reality is intensity matters a lot across all ages. If you're going to be working with a 2-year-old, man, you have to get the hours as high as you can to meet the needs of that child, so that they can close that gap, catch up, because the ages from about 1.5, 2 years old to about 5-ish are so critical. I'll talk about why that is in a moment. But even for older individuals, even into adulthood, you need to have enough hours for the treatment to work. And that's been demonstrated in research as well. There was a study that came out in 2016 that showed that intensity of treatment is very important for 1.5-year-olds all the way up to 12-year-olds. And there was another study that came out in 2014 that showed how intensity of treatment is so important for 13-year-olds all the way up to adulthood. I think on one hand, like on a basic level, this sort of does actually, make sense. Of course, if you get more time learning something or being taught something, you'll learn it better. We can all imagine this, let's say, with something like a musical instrument. Like if we were going to try to learn that, it's one thing to have a lesson an hour a week, but if you have somebody every day teaching you for 3 hours, wow, you're going to learn that instrument way faster, right? So intensity is very important. And then if you lay that over the point that I was making before about how the ages from 2 to 5 can be so important, I'm sure you can imagine that if you take a 2-year-old and start trying to teach them a musical instrument at that age, they would learn it way faster and keep that ability with them for a longer period. Now, all of that said, I want to clarify something about it. So, yes, ABA can help people at all ages, for sure. But I'm not saying that somebody should be receiving 30 hours a week of treatment for their whole life. That's not the point I'm trying to make. The point I'm trying to make is that once a child has reached the goals that you have for them and are in a position to maintain those goals without specialized treatment, then there's no need for that specialized treatment. But that doesn't mean that in all cases you would eliminate treatment altogether. I'll tell you a couple of examples of individuals I've worked with for like how this is played out. There was a little boy that I worked with from the time he was 20 months old until the time that he was ready to go to school when he turned 6. And he received intensive treatment for almost that whole time. He had closed the gap with his peers, but there were still certain skills, more advanced social skills, that we knew that he would have some trouble with. And so we kept treatment going, but it was at a much less intense delivery model. So once he started school, he came after school just a couple days a week, and then it got pared down to once a week for a little while, and then he discontinued services entirely. That might be one way that intervention can be faded out. There can be other ways too. there was a student, this was not a student that I worked with when they first started to receive treatment, but I know that they received treatment when they were younger, intense treatment, and started school. And this person is like a genius. He's won international awards in different software modeling contests, things that are much beyond what I know about. And I remember the first time I met him, he came back to work with us for, it was I think about a week if I'm remembering correctly. And he was much older at this point. He was 17 or 18 years old and about to start university. And they wanted some help with his organization because he wasn't the most organized guy. He would lose track of the things that he had. And so we set up situations where he had to keep track of a lot of things. And we did some intensive practice for a week to set him up for a very specific situation that we knew he would be starting soon. And he was able to improve a lot over the course of that week. But if we, spent 1 hour that week doing that work, it wouldn't have been much help to him. We needed that intensive work, even though it was only for a week or so. I could go on and on with different examples like this. The point is that you need to have the hours necessary for the improvements that you want to see. And for individuals who are less impaired or who have really caught up where they need to be, the intensity model may change over time. I mentioned also about the importance of that age from about 2 to about 5. So at that age, there are several what are called critical periods. That's really sort of a somewhat technical name that we use for times in development where individuals are really primed to learn certain skills very well. The one that I'm sure you know about and is most commonly known is about language and how, from about 1.5-ish, it varies a little from person to person, but 1.5, 2-year-olds ish to about 5, you learn language so much easier than when you're older, right? I know that all of you are aware of that. There are other critical periods too going on at that time, and that's why early intervention is so important. And wasting that time doing other things really can be detrimental to a child's later outcome, because that time can't really be made up in the way that's necessary to meet what would have been their full potential. Okay. The next important point is about what areas treatment can be helpful for, and importantly, what the intensity of treatment can do across all these domains. So when I'm talking about treatment domains, I'll list out some. Get ready, I'm going to rattle off several. So there's academic, there's adaptive, which is sort of like independent skills, cognitive, executive functioning, which is kind of like higher order cognitive processes like attention and things like that, language, motor skills, play skills, and social skills. And these are all domains that ABA can target. And the intensity of treatment, one of the reasons we need all those hours is that's a lot of stuff to work on, just that I said right there. And in order to do that, you need enough time during the day to target and really spend time teaching on all those areas, right? And research has shown that ABA can be effective in all those areas, but also that the treatment the treatment intensity is very important to see the improvements in all those areas. And it speaks a little bit what I was just saying about the critical periods, where it's not just about language. There's these other things too, that where an individual can be much more successful long term if you start early enough. Perhaps think about it is this. While we would, teach language and play skills and social skills and all of those and everything else that I mentioned, we're kind of teaching an individual to become a successful learner. So the idea is that I can give this person the skills necessary that they can learn effectively in other environments. And there are a lot of different sub-skills related to that ability. And they're in the domains that I just mentioned. And the intensity of treatment can help in all those areas, but it's really needed. That's why, like, let's say if you go to a speech therapist, they can have some like evidence-based ideas for programs to do. You would need, for the students that we work with, they would really need to do still a lot of hours. You couldn't skimp on the intensity. But the breadth of what they work on would be more narrow than what an ABA therapist would be doing. And certainly, let's say, like a physical therapist, they, I'm sure, have great ideas for being able to improve someone's motor skills. But again, the breadth of what they can work on is more narrow. Sometimes people have misconceptions about what an ABA therapist can do. They think of it as, oh, you guys just work on problem behaviors, or you only work on language or something like that. But the nature of our service is that we can target all of the necessary domains to get the student where they need to be. I want to acknowledge that there's a lot of resistance to intensive treatment. I'm not talking about people who just perhaps don't like ABA or something like that. There are people like that too, for sure. Maybe they've heard bad things about what we do, often inaccurately. Maybe they've had bad experience with bad providers. Because, by the way, just like any other profession, there are a lot of ABA providers who don't know what they're doing and are not really all that good. I compare that to, like as an example, to dentists. So in my life, I've been to many different dentists. Some of them have been like really good, excellent professionals, people who clearly know what they're doing. The setup of their office is inviting. It's fine to go there. And then I've worked with other dentists who don't know what they're doing. They just are not up to date on the most recent knowledge, don't seem to really be trying to care well for me. And we know from our own professions that every profession is like this, where there's some people who are good and some people who are not so good. ABA is like that too. But setting that aside, some people even have resistance to high quality intensive treatment. I want to talk a little bit about some of those concerns that people have, because they're not wholly unjustified. One, let's talk about the most obvious one, would be about time. In most cases, we are asking for a lot of treatment time. Like I said, 30 hours is a lot for service. It's unfortunate that it's that way, but that's how it is. You may want the world to operate differently, but this is the world that we're in. And the best treatment now takes some time. What I will say is that I cannot wave a magic wand to make the treatment go more quickly. I would love to do that, but I cannot do that. If you encounter anybody who is able to promise quick fixes or treatments that will be done in a few weeks or a few months, or only take an hour of your time each week, run away from those people, because they are offering you false hope for how this will go. Another concern, again 100% legitimate, is about money. So yeah, ABA treatment, if you have to pay out of pocket and have to do all these hours, it adds up. That's an unfortunate reality, again, about how this is just set up, you know. There are a lot of people involved, a lot of man hours that are given to an individual child, and it will just cost a lot accordingly. One thing that I'll point out, though, is that on a per hour basis, it's actually less than most other treatments. So let's say compared to speech therapists, for example, they charge more per hour than most ABA providers that I know. And it's just really the number of hours that makes it so expensive. But nevertheless, it does cost money. What I will say about this is as follows. You have to make a certain kind of choice about, you know, do you want to pay more now and less later, or do you want to just be paying forever? And kind of an extreme example, but one that's certainly based in reality, is that if you do an insufficient treatment program for your child when they're, let's say, 2 to 5 years old, and they do not make gains, they very likely will have impairments throughout their entire life. Perhaps impairments where they're not going to be living on their own at any point. That's going to, in some way, shape, or form, cost money. They're going to be needing specialized services for decades and decades. They're going to always be needing somebody to be looking after them. And that's a negative outcome. But that could be an outcome. And the money that you're able to spend when the child is younger, you get a much bigger payout from those dollars than spending too little all the time. Another way to think about it is that it's kind of like an insurance policy. Like you're paying some money up front to make it so that later on the problems are not going to be as serious. It's just some kind of assurance that you can give yourself that the problems that you're seeing now will go away. Because sometimes parents will not be convinced that the problems that they're seeing really require some kind of special intervention. They think, oh, my child will grow out of this, or it's not really so bad. That sort of, I was like this when I was a child, something to that effect. But if you're having professionals tell you that your child really does need some help, being able to provide the services now will kind of really limit the possibility that these problems will persist. You ultimately will be maximizing your child's potential, which I know every parent is looking to do. A few other sort of points of resistance that people have is that they're concerned that their child will be too tired from doing all this work in a week, which, again, I mean, I understand that point of view. Oftentimes the children that I work with are tired by the end of the day because we are working hard, right? That doesn't mean, don't get the wrong idea, that does not mean that we have the child sitting at the desk all day and we're drilling them with some kind of like academic teaching, all that kind of stuff. They may be tired because they've just been playing their heart out for a day when we're doing play and social programs, right? It's more about just they've been on all day, right? And yeah, they might be. Don't get me wrong. Not all the kids that I work with are like that. Some are like that. Yeah, they may be more tired at the end of the day. But the key thing that you are really doing in those situations is, yes, your child is more tired now, but less impaired later. That's the choice. Again, you don't want the world to be this way. It's not fair, but that's the situation that your child's in. That's the hand they've been dealt, and we have to attack it accordingly. Linked to that a bit is some parents will talk to me that they want their child to be able to just be a kid and sort of live a more kind of carefree life. I suppose, like, I can't sit here and say that that's wrong. I mean, that's just sort of a value that parents may have about how they want to raise their child, which of course is, they're entitled to have. What I need for them to understand is the implications of having that mindset, which is that you are locking in a certain limit on their potential, a certain lack of success by having that approach, which again, I believe that the vast majority of parents, if they really understand what the future might be like for their child, they would be looking to do as much as they can early on. Again, not fair, but that's life. It's not fair. And then lastly, parents may be thinking about the importance of other sorts of activities, whether it's like a play group or like a PE class, learning even like another language, something like that. They're all different kinds of like extracurricular, let's say, activities that children could do that they wouldn't be able to do because they're spending all their time in ABA when they're receiving intensive treatment. They don't have time for that. There are priorities that we have, and the priority early on is going to be about treating their ASD. Other activities will come later. And not only that, one of the things that a quality program would have in mind is being able to put a child in a position where they could go to some other activities and be successful there. One of the families I'm working with now is just in that position where their child has gotten to a point where they can try some other activities. Depending on the activity, it may not go so great, and they're trying to find the right ones for now. But he, or the family really, and including the child, have been working hard and have gotten their child to that point where they can do some other activities, and that's great for them. Okay, so that is what I wanted to cover about the importance of intensity of treatment. We had some parents send us some questions. Let me answer the first one. One is, how often should I see measurable improvements or changes in my child? I'll answer this question sort of in two ways. One is that improvements don't happen on like a fixed schedule, right? So it wouldn't be a situation where I could say, oh, a child should be able to talk in 6 weeks or something like that. That's not how it works. A main reason for that is that every child comes to any provider with different levels of impairment, different life circumstances, which are all going to greatly influence the rate of progress for them. Some children make a lot of progress right away. Others takes more time. But I do want to talk about more about sort of the measurable part of that question. So one thing that's important is that providers should be giving you a clear idea of what they are working on. Not just language, that's too general. Something more specific than that. It could be, oh, we're working on teaching your child some new verbs. It could be, we're teaching your child to be able to say out longer sentences that have 3 parts. Just as simple examples. There are, of course, a million. And then the progress doesn't need to necessarily be measured by like word count or something like that. The progress should be measured by just the skill acquisition. So, if the child is supposed to be able to say out longer sentences, when they talk to you, Do they say longer sentences, right? Are you seeing that kind of improvement on the specific targets that were provided by supervisors usually to you that they are working on? You can get into trouble if you're looking for something that's prescribed in terms of rates of progress, numbers of words to know, things like that, because what happens is that providers will end up kind of teaching to the test, so to speak. And instead of trying to treat the child, they will have some predetermined list of goals to target, and they will just be checking off the boxes on those goals. Meanwhile, they're not quite working on the targets that are most important for the child at any one time. On one hand, you do want to be sort of strict and objective about understanding what the goals are and having the goals be pretty specific. But what's actually being measured, don't get too tied up into measurement systems about exactly this and that. The goals that are being selected should be goals that make sense as being important to work on. They should be valid goals, and you should be seeing improvement in them. And you'll follow guidance from your supervisor about when the child has reached the standard necessary to move on to other targets. That's a little bit different than, let's say, teaching a typical child typical material in school. But that's, we're not a school. We're a health treatment organization and service. And so success is measured a little bit differently. Next question. Are there signs of a treatment approach that may not be working well for my child? There can be a lot of signs that a treatment provider is ineffective with their client. It would look a little bit different depending on what the treatment is, but I'll talk about some things to be on the lookout for. So one is, even before a treatment starts, if whoever the provider is making big promises, and I really mean promises, not just, this may or may not happen, but they're saying, oh yes, with this treatment, this will happen, and it sounds too good to be true. It is too good to be true. Be aware of that. And that already is a big red flag. But once you get into treatment, there can be other red flags too, and it often is around goals. So any treatment should be able to tell you what the nature of the improvements are that you would see. They should be things that are identifiable in some way. A red flag would be if you're not being given clear goals that are being targeted, or if the goals are kind of like switching over time, or a treatment provider is like taking credit for improvements the provider had not said their treatment would help with. I see this often, especially with medical style treatments where the targets will be very vague. So you'll see improvements in behavior. Well, what does that mean? Right? It needs to be more specific than that. And then not much will change in their behavior, but their language might improve a bit. And then the treatment provider will say, yes, the language improved, I knew it. It's like, well, that's not what the treatment was supposed to even help with, right? So that would be somebody who is giving you a red flag for what it is that they're doing. There can be other red flags that are maybe a little bit different for new parents or parents who are new to treatment to get a quick handle on, but it simply has to do with the rate of progress. So if you're working with a provider and you're just not seeing any progress after months, that's a problem. Again, I can't say anything really objective about like, oh, if you don't see your child learn 10 new words in 2 weeks, that's a sign that there's a problem. It doesn't really work like that. It's more complicated because it's all relative to the child and whatnot. But most children, you would be expecting to see some progress. And if you're not seeing progress with the goals that are identified by the providers, that is a red flag. You may have more questions. I would expect you to have more questions about ABA, about what's going on with your child. I encourage you to perhaps contact us for a parent consultation, free of charge, so there's no real drawback for doing that. You'll meet with us and have a more in-depth discussion that will apply most directly to you and your family's situation. Hopefully I'll see you soon, and thank you for joining me. Bye.